Hi, and welcome to yet another session in our live series designed to help you take a step towards parenthood. If you've been tuning in, every week, and so we've been talking about infertility, causes, the role of COVID-19 pandemic in all of it, and IVF. But today we're going to discuss what exactly you can do in order to ensure that you have a healthy IVF pregnancy. In conversation with us, we have Dr. Narmada Katakam. She is a fertility specialist and gynecologist who has been accredited by the British Fertility Society in the United Kingdom. She's also a specialist in minimal access surgery. Thank you, ma'am, for giving us your valuable time.
Thank you, Meghna. Welcome to audience, and I'm quite happy to share my views, suggestions, and tips and tricks how to increase the chance of a successful IVF pregnancy.
Ma'am, right off the bat, what I would want to ask you is that what are the major do's and don'ts that women should, remember when it comes to IVF pregnancies?
I'll go by do's first and don'ts next. In the do's, the key word is moderation. Do anything in moderation. Do not overdo. Do not believe that one action is going to make the IVF pregnancy successful or not successful. The word is moderation. Whatever I say, just do everything in moderation. You'll be hearing about a lot of these things here and there, but I'll just summarize everything together and put in one place. And all these things, whatever I'm going to say, listen to your body. Everybody's body is different. If I say about diet, if I say about exercise, everybody's body responds in different way. So one thing is moderation. Second thing is listen to your body. Nobody tells you better than your own body. So the do's include eat healthy, eat on time, eat small meals, don't eat junk food. Whatever makes you happy, probably junk food, sweets, and desserts and all, that's a big no. Because you need to maintain good moderate weight, and that moderate weight cannot be maintained unless you eat healthy. So the healthy eating and maintaining the weight and eating what is necessary and leaving what is not necessary. Coming to the exercise, we are all come from different walks of life. Some of us do minimum 10 kilometers of walking or running every day, and some people have never exercised or probably walked for 5 minutes. But 10 to 15 minutes of little moderate exercise is good while you're trying to conceive, and a little less intense exercise is very good throughout the pregnancy to make you feel healthy and to recover very well after delivery as well. Diet, exercise, weight, and the most important thing is sleep. Make sure you do sleep well. There will be stages in pregnancy where you can't sleep, or you have nausea, you feel like getting up, or you want to pass urine more often. Try to make sure you sleep at least 6 to 8 hours a day, whichever time it is possible. Some people can't sleep till early morning, then sleep the rest of the time. And after IVF, after you're pregnant, the journey is very, very easier compared to when you're waiting for the pregnancy results. Identify your own stress busters. Make a list of your stress busters. Some people like playing games, some people like online games, some people like walking, going to the parks, a friend who can listen. You don't want them to give an answer to your problems. You want somebody to listen to what you're saying. Identify your own stress busters. That will help a lot. So, diet, exercise, sleep, stress busters, listen to your body. Those are my big do's. Don'ts. As soon as you think of IVF, your life is not on a pause. It's not on a hold. It carries on. IVF runs only in the background. If you make it your big part of life, then your life becomes miserable because the whole focus is on what's going to happen, what's going to happen. If it happens, it happens. You know that you are trying your best. You know that your doctor, you're trying your best. You know that you've chosen the best fertility center, the best doctor, and the best options available. Just leave it. Things will happen better when you relax rather than you make it the only point in that part of the life. So that no pause to your life, the play button is on. And the rest of the things are very simple. A lot of you know, all of you know. No substance abuse, no smoking, no alcohol, because all these will make the baby have the effects of all those substances. Coffee in moderation, probably one will do. Do not take any medication without advice of your doctor. No over-count medication. over the counter medication, no going to the pharmacy and buying something, because they will not know you are undergoing an IVF treatment. Any doctor you go, just tell them you are either pregnant or undergoing IVF treatment, because the medication which are not supposed to be given to a pregnant lady are also not supposed to be given to a lady who is during the process of treatment. And the other thing is just avoid getting any infection, which includes eating raw food or salads or half cooked chicken, or exposing yourself. Probably you don't get a lot of cold and cough now because most often you are masked. But if you
Yeah.
go into a crowded area, even there is no second wave or first wave or second wave or third wave, just to make sure you don't go to crowded areas where you can easily catch cold and cough.
Hmm. Hmm.
And when I
Hmm.
said all this is applicable both to the man and the woman.
Okay.
It's just not the women. Man also equally has all these things, because women gives the egg and man gives the sperm, and all these things have equal impact on both of the gametes. Having said that, once the woman is pregnant, so the man doesn't need to comply with all these things, but you can always support her. Like,
Hmm.
I can eat junk, you don't eat junk, you eat in front of her. Obviously, it's not such a nice
Yeah.
experience. So try to support her. So those are the big do's and don'ts. Hope it was crisp.
Okay. There are No, no, absolutely, absolutely. I think, and I really appreciate the fact that you pointed out that both men and women, while they're trying for IVF, need to keep these things in mind, because we often think it's only the woman who needs to take these precautions. Man ka kaam hi kya hai wahan pe, which is absolutely wrong. And I'm very happy and glad that you pointed that out. So, ma'am, there are a lot of concerns, or rather doubt, regarding IVF babies being healthy. What can the patient do during the process and while she is pregnant to ensure that she has a healthy baby?
Okay. One thing we all have to remember, the first IVF baby is only 43 years old. So all this science has phenomenal progress in the last 43 years. If you think about any other area in the science, in 43 years, no area made such good progress. Being so recent, there are a lot of doubts and suspicions on how good the process is. A lot of people come and say, "Oh, IVF baby, will people recognize?" I tell them, if you walk 1 kilometer, you'll cross so many IVF babies, you won't even realize. They look normal, they feel normal, they talk normal, they eat and do everything normal. With regards to IVF, when you think about are the babies healthy, I'll tell you something very interesting. There are a lot of studies which say that IVF babies are little more smarter than naturally born babies, and their cognitive abilities are higher than normal babies. So, if there is any fear of something going wrong, just remember cognitive abilities are better, and they are more smarter, and they have higher IQ. So, that's a positive thing. Coming to the neutral point about being healthy, they think that there will be a lot more birth defects in IVF babies than others, but the number of birth defects in IVF babies is same as spontaneous pregnancies. There's no difference. There's only one area where you have to be a little concerned. Some IVF babies can be born prematurely, or they may have low weight. It's exclusively not due to IVF, but if there are twins, the
Hmm.
twins they can be born little early. That's why premature, because they're premature, they can be smaller in weight. So I'm trying to say, if you need IVF, go for IVF wholeheartedly. Do not go with the fear. It's not a bomb. It's not a vaccine which is not tested. It's not a drug which has not been tested.
Hmm.
Louis Brown, the first lady, first baby, IVF baby, she already had a natural pregnancy in the birth. The first IVF baby in India, married and spontaneous conceptions, and also do not worry what happens to you, what happens to the baby. You be rest assured for the next generations as well.
Okay. Ma'am, you were talking about birth defects. So, in the previous conversations that we've had in our sessions, a lot of the doctors that we've spoken to have pointed out that the older that you are, when you're going through, let's say, an IVF procedure, the higher the chances of your child having certain genetic birth defects. Is that true, do you think that could be the reason why people are a little afraid of IVF, because they're just putting two and two together without factoring in the age?
That's such a good point you made. Because most people who get pregnant on their own, they're much younger.
Hmm.
Rest of the people, either they're going around places or they've been contemplating, waiting and waiting. With the increasing age, again, a woman thinks if she is older age, she'll have an abnormal baby. The message again, older men have higher risk of abnormal babies. There are different syndromes called Downs and Turners. Older mothers have higher chance of Downs babies. Older fathers have higher chance of Turner's babies in wherein one chromosome is missing. Having said that, these couples who are older mothers and older fathers, even if they have a natural pregnancy, they exactly have the same risk of having this abnormality. It's nothing to do with IVF.
Hmm. And I'm really happy about the fact that you pointed out that older men also can contribute to these birth defects, because again, we only talk about, oh, jitna zyada औरत का उम्र होगा उतना ज़्यादा problem होगा. So again, I mean, this is really interesting that both partners have
Very
an equal
interesting.
play,
Yeah.
because biologically, right, we say that a woman's clock is ticking, but a man unfortunately can, or fortunately can go on producing babies in his 50s as well.
Yeah.
So this is an interesting point, and I'm glad we're talking about it today.
Yeah. Yeah. There's definitely less social awareness about the men's age. But I thought this platform will make use to say that there's an effect as well. And I'll tell you one more interesting aspect. Let's say a couple have a baby. Only the mother comes for investigations. He says, I already had children. I ask her, can't you tell the same thing? You also had a baby. So
Hmm.
both are equally responsible for not having a baby for whatever the reason is. So there's very limited social awareness, both in the women as well as the society, that both are equally
Yeah.
contributing to the factor.
Yeah, absolutely. You're right. You're bang on there. There is actually very little social awareness, and you're right also in saying that this is the platform to sort of also talk about that amongst other things.
Yeah.
So, how can patients ensure successful embryo implantation?
There are a lot of reasons why they didn't get pregnant. Same reasons will be valid how they can get pregnant. Let's say older age, that's not going to change. Heavier weight, probably they can do the moderation. What is most important is have realistic expectation. Suppose you're very young, the IVF is happening only for the tubal block, the sperm is absolutely normal. Your chances can go even beyond 60%. What is important? Suppose you're 35 and your BMI is 35 and you're thinking that you'll definitely have a baby, your dreams will be shattered. The basic point is have realistic expectations and build on that. Have realistic expectations at the same time, stay very positive. It's hard, but you can't be feeling very negative and expect a positive result. You're self-contradicting the feelings. Okay. And what is another important thing is have a very good support of both the medical fraternity as well as the family. If family is under pressure, this lady has nowhere to go. The only thing family should do is support her. It's okay. It's going to happen. If it doesn't happen, we have another go. Those are the emotional things. Coming to making it much more convenient, if people are working shifts, people are working long hours, better they take a little time off. If they're doing intense exercise, don't do intense but moderated. I already told about not eating outside food, not because outside food is bad, just don't get any diarrhea and vomitings when the in the stage where your embryo is trying to connect with you. So those are the things. And medication. Rest of the medication is fine. There's definitely some hormonal support given to the advice to the women to take, and uh, do not skip any of those medication. And if it is hormones, take even with an alarm. Even if it's disturbing you, that's fine. But put an alarm and take the medication. Moderate exercise, meditation, and again, as I said, stress busters. Whatever makes you happy. Does sleeping make you happy? Sleep. Listening music makes you happy? Listen to the music. Shopping makes you happy? Shop. And another thing is the age. If the man is older than 45, the woman is older than 35, rather than praying, see if you can have an embryo biopsy and then get it transferred. Your chances of success are definitely higher. So those are all the few things which you can do to increase a successful implementation and a positive outcome.
So take care of your body, take care of your mind, and talk to a doctor. Know your options because it's going to happen, but you need to have a positive outlook.
Another example, sorry, just adding a
No, no,
story.
absolutely. Please go ahead.
So there are some couples, let's say at least 20% of the couples who walk into my hospital genesis, they definitely want to try their own baby.
Hmm.
We counsel them, we tell them this is the ovarian reserve, this will be the success rate if you use your own gametes, but if you use the donor gametes, this is success rate. We give all the information. Some people are desperate and they say, I want to try at least once. If that's what your gut feeling says, try. Otherwise,
Hmm.
you'll be regretting all your life that I never even tried.
Hmm.
There's a little bit about money, there's a little bit about gut, but
Hmm.
listen to yourself first. You are important rather than your money. Money comes, money goes. But you don't want to live with the guilt that you didn't even try.
Hmm. No, you're right. Absolutely. Absolutely. So, ma'am, in your practice, since you have such nice, tales and stories to tell us, I'm sure in your practice you've come across a whole lot of myths about embryo transfer also. Can you share some with us here today?
Don't even want to start. There's so many myths. It's good entertainment at the end of it. At the same time, we empathize and we don't laugh at them, we laugh with them.
Yeah.
The first important question, bed rest. I always tell them if that will make you pregnant, I'll tie all of you to the beds and make you pregnant. Immediately understand and the link to it. Just lead your normal life. Don't do anything intense. Do your normal life so that you're not completely bogged down with the feeling that you're waiting for the pregnancy test. Bed rest will not increase the success rate. That's the first myth. And some people, they think resting after embryo transfer will get the connection. Another story I have. After when I was working in UK, like our room had a passage followed by turning into the room. We entered
Hmm.
the room, we didn't find the lady. I was thinking, where did she go? You will not believe. She was doing Shasana on the bed.
Oh
Head
God.
on. I said, what are you doing? I'm just making my embryo settle into the uterus. I said, we would do that to everyone if that's what is going to increase the success rate. So postures, which side do you sleep? Right side of the bed, left side of the bed, having sex, not having sex. All these things are myths. If the embryo is going to get connected, it's going to get connected.
Very
The other
interesting that you've spoken about Shashan. There are so many pop culture moments, so many movies, so many web series and television serials where they show exactly that. Whether it's IVF, embryo implant, or pregnancy post sex, the woman will have her legs up because that will help for sure. So
and
I am not surprised where that comes from.
how many couples after sex do Shasana? Same. This is what is happening. The embryo is going into the uterus. That's not going to change. And the other big myth when they walk into the IVF center is when I tell them success rate is 40, 50, 60, depending on what they are. Oh, is it not 100%? I ask them to go to temple. 100% success rate in IVF is a myth. Only God can do it. And if somebody says they can do 100% success, it's a lie. So that's a big myth people have 100% success rate. Another myth they have is all IVF pregnancies will be twins.
Hmm.
They will be twins only if two embryos are transferred and two get implanted, or more embryos are transferred and you get triplets or whatever. But IVF does not lead to twins. It's the number of embryos, and you
Hmm.
should have a consultation with your clinician about how many embryos are transferred, what's the likelihood of one baby, two babies, and possibility of triplets, and all those things should be discussed. IVF does not lead to twins. So those are
Which,
all
yeah.
the few interesting myths. Yeah, yeah.
Yeah, again, twins, triplets is a big one that and you hear a lot.
Yeah.
So yeah,
One of my
okay.
relatives was asking. I have few friends who had twins. So in your IVF center, do all mothers have twins? So it doesn't run like that. It's all very individual way of dealing and counseling the patients.
No, but twins also sound so good. No, you go in once and then you come back
Yeah.
with babies and you're done.
Yeah.
Okay. So we were talking about medications earlier, when we were talking about the do's and don'ts. Can you tell us a little bit about what kind of medications can hamper a successful IVF pregnancy?
The mantra: do not take any
Hmm.
medication without speaking to your doctor.
Okay.
Every medication has an interaction with what you're taking. And I always tell couples, apart from Dolo, that is paracetamol, do not take any medication without asking us. No over the counter medication. There will be people who will be taking, I don't know, herbal, Ayurvedic, whatever, to make the baby male or female.
Hmm.
The life is already made. The destiny is already been decided. Drinking these fluids is not going to change anything.
Yeah.
So do not take anything which is not advised by your doctor. If you
Hmm.
develop any symptoms, if you go to a specialist, tell them you're pregnant or trying for pregnancy, or speak to your own specialist saying, can I use this medication? So a big no. And no any medication, a big no. Things you can take without speaking is the micronutrients where you have magnesium, calcium, and multivitamins and vitamin D. All those things are okay, but your doctor will anyway prescribe them.
Hmm. So, what are some of the supplements that are usually prescribed to women? While let's say if they're pregnant after an IVF treatment, what are the supplements that you prescribe usually?
Folic acid is a big one.
Hmm.
How that helps is when the baby is born, it reduces the defects in the brain and the spine.
Hmm.
So that's given to everyone. Rest of the micronutrients, iron is given to women who are deficient in iron. Things like vitamin, selenium, zinc, magnesium, and all those things are proven to increase the success rate given in very small quantities. Just because they increase, just don't gulp hundreds of them.
Hmm.
I'll tell you another story based on this. When I was working in UK, the only drug given was folic acid.
Hmm.
No other drug. And when I came back here, I practiced the same thing.
Hmm.
Then I realized women are not as nourished here. I'm not being judgmental or anything, but that's what we are available because vegetarian food is a big surprise to them.
Hmm.
Almost all of them, unless they are vegans, they eat non-veg. So they get
Hmm.
proteins with what they cook with. They get all the micronutrients. So we definitely lack some micronutrients. So supplementing those will improve the health of the mother along with the health of the egg. So that makes
Hmm.
it better. So all our fertility specialists do prescribe them to the women.
But also go to a fertility specialist to get those, because from what I understand, too much of these supplements is also not going to help you
Not at
in any way.
Not at all. Yeah. As the first line I said, in moderation. Yeah.
Yeah. And talk to your doctor about any medications.
That's it. That's it. No point in going behind them. Just
Hmm.
openly discuss. Maybe what you're saying is right, what she might agree with you, but just openly discuss and then carry on.
Hmm.
One
So,
big drug, the
yeah.
painkillers.
Yeah.
Painkillers are the most commonly used tablet, but
Hmm.
that definitely impairs the successful IVF and also affects the baby's development in terms of kidneys and the heart.
Hmm.
Do not specialist. There are a few painkillers which can be taken. Always
Hmm.
ask before they are taken.
Hmm. ठीक है. Also, I had a follow-up question here. We are in the middle of a pandemic, so there is a chance that woman who's pregnant with IVF or otherwise may contract the infection. And if you are infected by COVID 19, there's a long list of medications that you need to then take, the made ivermectin or something else. What happens in that case? What happens to the medication course in that case?
When a mother is pregnant and there's a baby,
Hmm.
mother is always the priority. It's always the mother.
Hmm.
As a medical fraternity, we always decide based on how bad the mother's health is.
Hmm.
If a drug is going to save her life, that's definitely given.
Hmm.
As we all know, COVID is so new. Most drugs used in COVID is also new, and all those drugs do not have long-term studies in human.
Yeah.
So it's all an evolving process. Some are very clear, they won't cause any harm, those can be anyway given. Some which are not to be given are not given at all, which are borderline, they're given to the woman only if she needs it. One of my relatives who was 16 weeks pregnant had to be given some medication. She had the similar fear. So what we do is, anyway, she has to be given, she has to be given. Follow up with the detailed scans. The worry is, will it affect the baby? Follow up with the detailed organ scans. We call them TFA and fetal echo in whatever time period of the pregnancy they are. They will pick up if there are any problems. And what's going to happen with all these COVID babies in next 2 or 3 years, we'll all will know anyway.
No, absolutely. Now, there are also studies that talk about how antibodies are passed to the baby. So that's, I mean, at least gives mothers some hope, right? That even though you may have suffered,
Yeah.
that just means that your child has those natural antibodies.
Yeah, that's a blessing in disguise. You get
Yeah.
vaccinated, pass on the antibodies to the baby. You get infected, pass on the antibodies to the baby. You can breastfeed. There are a lot of good things compared to how it was in, let's say, March 20. But things are much
Yeah.
better now.
No, absolutely. Absolutely. It is a blessing in disguise, as you say.
Yeah.
So, what kind of self care methods do you suggest to deal with, you know, the sort of, no, I won't say the complications of the IVF process, but the ups and downs of IVF process, especially mentally, since we've spoken about that a lot. If you could talk about some self-care methods, I'm sure the men and women watching this would be, extremely elated.
Yeah. Most importantly, as I said, understand why you need IVF. Every IVF center gives a detailed information about the process, but because the couple are so stressed, half of it goes in, half of it goes off. Speak again. At least read the leaflets the hospital is giving. Read the notes the hospital is giving. Watch videos, but watch genuine videos from good websites. Don't watch things which will scare you. And if something really scares you, go and clarify. This is what I watched. This is what I understood. Is this right? And is this applicable to me? If it's not applicable to me, what the only thing you're doing is stressing yourself out. So understand why you need, understand the process, listen carefully, and try to understand what has been informed to you. That's the basic ground rule. And there are few things which happen. Let's say the most important thing is the bruise, the pain of the injections. There's so many injections. One of the patients was telling me, in the 3 months, I've taken 92 injections. Then I said, you have babies in your hand. So try to see what is the pain and what is the outcome. And without those, you would not have had a pregnancy. Remember, that's only short-lived. Try to use the ointments which will reduce the blood clotting. Try to use ice packs to reduce the pain. Try to choose injection site a centimeter or two away from yesterday's site. Do all those small things so that you don't suffer. And remember, there's a positive outcome at the end of it. Or you can tell yourself, no pain, no gain. So that's the biggest thing people are worried about is the injections. The rest of the things are the bloating and nausea, where they feel like vomiting but they don't vomit. That can happen because of the drugs. And tell your doctor that this is what you're feeling. Maybe they'll change the drug or reduce the dosage or so and so. Or sometimes they may say, this for this period you have to use this. I'll give you medication to reduce your bloating. Another thing is constipation. The hormone progesterone, just let's say P, the hormone P, which is produced by a woman's body to support the pregnancy. Maybe one of the reasons is they didn't have it enough. That's why they didn't get pregnant all these days. During these supportive therapies, we pump up a little higher amount of progesterone so that the pregnancy continues. It causes very bad constipation. A lot of women have bad constipation. So be aware you have constipation. Women has constipation, and lot of homemade tricks. Eat leafy vegetables, eat brown rice or eat whatever. Drink a lot of fluid. Keep an laxative syrup handy. Every day you don't open your bowels. Just drink 3 spoons of laxative. Don't be worried that they'll get used to the laxative medication. You won't. Once the progesterone is off, the bowel movements are back. So if a woman needs something, it's temporary. They don't need to be worried that it becomes a permanent habit, and they don't need to suffer during that period. And the other things they have because of the hormones is the headache. And if they're pregnant, fatigue. That fatigue can be because of medicines or because of pregnancy. If your fatigue don't work, relax, listen to the music, do what you like, ask somebody else to cook. So just think about what it is causing, and just try to identify what will make it better, rather than thinking, oh my God, I'm feeling miserable during pregnancy. Just identify which part of it and try to fix that specific point rather than making it a wholesale process that I'm not feeling good. Irritability and mood swings. They go without saying. And when I ask how are your mood swings, I always ask the husband. This lady won't know she's having mood swings. She's already feeling not good, and then she's irritated and she
Yeah.
always asks her husband, and he says no and he says yes. So only remember, this is very short lasting.
No pain, no gain.
No pain, no gain. Yeah? And then sometimes little bit of pain here and there, little bit of pain in the lower tummy, upper tummy. It could be because of the increasing size of the womb, causing stretching of the ligaments. It could be because of the hormones changing all how tight the ligaments, they become little lax. So your movements will also be very wobbly, so that causes little pain in the joints and all. They are all normal. Just identify what are normal and reassure yourself. What is not normal, speak to the specialist.
Okay. So, we're coming to a close of this very, very interesting session. But before we, call it a day, I wanted you to sort of give your last words or your advice to all the couples out there who are trying to get pregnant with IVF or without it.
Sorry, can you repeat again? I just got distracted with the comment. Somebody said Hindi mein bolo. I'm going to answer your question in Hindi.
Very good. Okay. So before we call it, a day for this session, I want to know what would be your advice to couples who are trying to get pregnant out there. What would be your golden tips for them?
परेशान नहीं होना, जो होना वो होगा, भरोसा रखना, जो एडवाइस दिया वो बराबर एडवाइस फॉलो करना, एंड सोचना रास्ता है, एक बारे में सक्सेस होता ऐसा मत सोचो. नहीं हुआ, गलती आईवीएफ सेंटर की नहीं है. ऐसा हुआ कि एग में या स्पर्म में प्रॉब्लम था, इसलिए नेचुरल प्रेगनेंसी नहीं आया. उसको ओवरकम करने के लिए जो भी स्टेप्स है, आप, आपकी बीवी, आपके डॉक्टर, आपकी फैमिली, सब लोग मिलके काम करना पड़ेगा. सब मिलके काम करो, थोड़ा वजन कम होता, थोड़ा स्ट्रेस कम होता. पहले समझो क्यों हो रहा है. माई गोल्डन लाइन, परेशान नहीं होना, सुनना, सोचना, पॉजिटिव रहना. थैंक यू.
That's a very, very positive note to sort of end this session on. Thank you so much. It was a real pleasure talking to you, and again, thank you so much for your time. I'm sure everybody who's watched this is gone home wiser.
Thank you.
Thank you, ma'am. Have a nice day.
You too. Thank you. And have a nice day, all of your audience.